First, I'm going to identify the 5 subcutaneous injection sites. It is the back over the scapula, the upper buttocks, the posterior upper arm, the abdomen, and the interior upper thigh. So the first thing that I'm going to do is I'm going to verify the doctor's order with the MAR. I'm going to check for patient allergies, and I'm going to perform hand hygiene. And also the reason for site rotation is because if you keep putting injections into the same site, the skin is going to become irritated and it's not going to be able to absorb as effective as it should. I'm going to gather my supplies. I have my insulin syringe, my medication, alcohol swabs, and my MAR. So if I were to calculate this, I had an order for Novalin. Well, first, what I'm going to do before I even go to calculate it, I'm going to check my medication 3 times. I'm going to check it whenever I get it from the storage area, before taking it out of the container, and immediately before administration. Then I'm going to, since I make sure that it's right, I'm going to calculate my dosage. I have an order for Novalin R10 units subcutaneously every morning. And what's available that says on the vial is Novalin 100 units per milliliter. So since I'm using a syringe that goes by units and my medication is by units, I wouldn't really have to calculate anything unless I'm trying to find the milliliters for it. So this is my work. Okay. So after I calculate my dosage, I'm going to prepare my medication. Well, whenever I look at my medication vial, I'm going to check the expiration date. I'm going to check for any contaminants or defects in it. Okay. I'm going to get my alcohol swab. I'm going to clean the top of it for 30 seconds in a circular motion and let it air dry. Then I'm going to get my syringe. I'm going to take the cap off. I'm going to aspirate 10 milliliters of air. Then I'm going to inject it into the vial. Then I'm going to inject 10 milliliters of medication. So whenever I go to recap it, I'm going to have to do like this. And put the cap back on it. Okay, so now that I've prepared my medication, I'm ready to go to my patient's room. Whenever I go to my patient's room, I'm going to have my medication, the MAR, and the alcohol prep pad. Whenever I go into my patient's room, I'm going to identify the patient by checking their ID band and having them state their name and date of birth. After I do that, I'm going to perform hand hygiene, don clean gloves, and recheck for any allergies. Now I'm going to prepare for administration. I'm going to position my patient in a comfortable position, expose the subcutaneous injection site, and provide for privacy. Okay, so after I did that, I'm going to get my alcohol swab. And I'm going to clean the injection site in a circle from center to outward for 30 seconds. And let that air dry. Okay, so I let it air dry. I'm going to get my syringe. I'm going to take the cap off. I'm going to hold it in my right with my dominant hand. I'm going to squeeze up the injection site so I can get a good layer of the subcutaneous layer. Now, if this was a thinner person, I would inject it at a 45-degree angle, but and if it was a bigger person, I would inject it at a 90-degree angle. So I'm just going to act like this is a bigger person, and I'm injecting it at a 90-degree angle in a dart-like motion. Now I can let go, hold it, and I can inject it and quickly withdraw. And you never aspirate with this. Then you also never massage the area, you just pat it and then put a cotton ball or Band-Aid over it to cover up the site. Then I'm going to put my needle in my sharps box. After I put my needle in my sharps box, I'm going to position the patient back to comfort. I'm going to take off my gloves and I'm going to perform hand hygiene. Then I'm going to document it by initialing the MAR with the site and the medication and the time that it was given in. And then state the effectiveness for 30 minutes after administration.